Ever feel like playing detective? Well, today, we get to be medical detectives.
Oh, cool.
We're diving into a case straight out of a microbiology textbook.
Sounds intense. Which one?
It's the OpenStax Microbiology book. You can find a link in the description.
Awesome. I love that book. So what's the case?
It's a fictional one, but it really makes you think. Picture this. A 1-year-old baby, Olivia, is rushed to the ER. She is just not herself.
Poor thing. What's going on?
I'm talking excessive crying, irritability, sensitive to light, super lethargic, and she's vomiting too.
Oh, that's rough. Sounds like a really worried parent.
Absolutely. And there's more. The doctor finds swollen lymph nodes and a tender spleen.
So if I'm the doctor, I'm already thinking infection.
Right. I mean, all those symptoms.
Yeah, especially the swollen lymph nodes and the spleen.
It just screams systemic infection.
Absolutely. Her little body is battling something serious, some kind of invader.
Yeah, and poor Olivia is clearly in pain. She doesn't even want to turn her head.
Oh, neck stiffness. That's a huge red flag, especially in a baby that young.
What does that make you think of?
Meningitis. Has to be on the list of possibilities.
Meningitis, wow.
Yeah.
That's inflammation of the membranes around the brain and spinal cord. Right?
Exactly. Definitely a serious condition.
So what happens next? The doctor obviously needs to figure out what's really going on.
Yep. So they'd order some tests, a complete blood count, for starters.
CBC. Checks for signs of infection in the blood itself, right?
Exactly. Then a blood culture. That helps to pinpoint the exact bacteria causing the infection.
Oh, so they can target it specifically.
Exactly. And of course, a lumbar puncture.
A spinal tap.
Yeah, to analyze the cerebrospinal fluid.
Makes sense, since that fluid is all around the brain and spinal cord.
If there's an infection there, it'll show up in the fluid.
And in Olivia's case, the results are pretty alarming.
The CSF is cloudy.
Cloudy? Is that like literally cloudy?
Yeah, it can look cloudy when there's an infection.
Wow. Okay, so what else?
Her white blood cell count is really high, way above normal, 28.5 kL.
Whoa, that's a lot. Normal is what, like 10?
Yeah, around there. So this is way up. Her body is sending out an army to fight.
And they found a high percentage of neutrophils too, right?
That's right. Those are the white blood cells that specialize in fighting bacteria.
Okay, so that's another clue pointing towards a bacterial infection.
It is. And the glucose levels in her CSF are very low, only 30 millijoule on 100 millibelow.
Why is the glucose level important?
Well, bacteria feed on glucose. So when the glucose level is low, it means the bacteria are eating it all up.
Oh, I get it. So it's like a sign that there's a bacterial infection going on.
Exactly. Plus, there's a huge increase in white blood cells in the CSF itself, 11,163 millimeter through 3. The infection is definitely in her nervous system.
Wow, that's scary. So we've got this really sick baby with classic meningitis symptoms, and the lab results confirm a serious bacterial infection.
Yep. And this is where it gets really tricky for doctors. They have to act fast. They can't wait for all the test results to come back.
So they're treating her for bacterial meningitis even before they know exactly what's causing it.
That's right. They start her on broad-spectrum antibiotics.
So that covered a wide range of different bacteria.
Exactly. It's like using a wide net to catch the culprit, no matter what it is.
And they'll adjust the treatment once they know exactly what bacteria they're dealing with.
Exactly. They also started rehydration therapy, too, because she was vomiting.
Of course, she needs to stay hydrated.
That's crucial.
So even without knowing the exact bacteria, they can start fighting back.
Yep. Amazing, isn't it? Modern medicine is incredible.
It really is. So did Olivia get better?
She did. Thank goodness. Her condition started improving after a few days on the antibiotics.
That's a relief.
And follow-up tests showed no more bacteria in her blood or CSF.
That's great news.
And her white blood cell count went back to normal, too.
So the antibiotics did their job.
They did. It's a powerful weapon against bacterial infections.
I'm still curious, though. What exactly was the bacteria causing all this trouble?
Well, the lab finally identified it as Neisseria meningitis.
Neisseria meningitis. So that's what causes meningococcal meningitis.
Yes, that's the one.
And what makes this particular bacteria so nasty?
It has a trick up its sleeve. Literally. It's got this thing called a polysaccharide capsule.
A capsule.
Yeah, think of it like a shield around the bacteria.
So it's like wearing armor.
Exactly. And it makes it harder for our immune systems to fight it.
Because it's harder for our immune cells to grab onto it and destroy it.
You got it. That capsule is a major virulence factor.
Meaning it's a feature that makes the bacteria more dangerous.
Exactly. It's why meningococcal meningitis can be so serious.
So why was Olivia so susceptible to this infection in the first place?
Well, remember, she's only 1 year old.
Right.
And at that age, Babies have lost the passive immunity they got from their mother's antibodies.
So they're kind of in this in-between stage.
Yeah. And their own immune systems are still developing, still learning.
So they're more vulnerable to these kinds of infections.
Exactly. Their defenses aren't as strong yet.
That makes sense.
Yeah.
But is there anything we can do to protect them?
Actually, yes. There's a vaccine for meningococcal meningitis.
A vaccine. That's great news.
It's called a conjugate vaccine, and it's very effective.
So parents can actually protect their kids from this.
They can. It's usually recommended later in childhood.
Right.
But it's actually approved for babies as young as 2 months.
Oh, wow. So they can get it really early.
They can. It's all about protecting them during those vulnerable years.
I never realized how important vaccines are at such a young age.
They are. And Olivia's case, even though it's fictional, it highlights that.
This deep dive has been fascinating and a little scary, honestly.
I know what you mean. But also amazing, right? All this stuff happening inside us all the time.
Yeah, we really take our health for granted.
It's true. We should never underestimate the power of the microscopic world.
And this case definitely shows how important research is and vaccines and early treatment.
Absolutely.
So what are your takeaways from this case? Let us know in the comments.
Yeah, share your thoughts.
And maybe do some research on your own. Learn more about microbiology. It's a fascinating world, full of mystery and wonder.
I totally agree.
It just makes you realize how much we still don't know.
For sure. There's always more to discover.
And that's what makes it so exciting.
Absolutely.
All right, that's it for this deep dive. Thanks for listening.
Thanks for having me.